Hello everyone. How are you? You've probably heard about strokes, right? But did you know that the body can give you signs up to a month before a stroke occurs? If you notice any of the signs I'm going to mention, see a doctor immediately, as they could be signs of an imminent stroke. These 7 signs can appear up to a month before a stroke, and the longer it takes without a proper diagnosis, the greater the risk of brain damage. Regardless of age or health, everyone can be at risk, especially with the increase in cardiovascular diseases among young people. So stay tuned, because today I'm going to explain the 7 signs your body can give you a month before a stroke and how to prevent this disease. Let's go. Hello, friends. Today we're going to talk about a very common disease, stroke. In the world, someone suffers a stroke every 2 minutes, totaling almost 800 cases per day. Unfortunately, 300 of these people do not survive, and many of those who survive face after effects. The signs that precede a stroke can be subtle and are often ignored. It's crucial to recognize them, regardless of age or health. I'll explain the difference between ischemic and hemorrhagic strokes and talk about brain aneurysms and transient ischemic attacks, TIAs, which can precede a stroke. An ischemic stroke occurs when there's a blockage in the blood supply to the brain, usually caused by a clot or fatty plaque in the arteries. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, causing bleeding. Both are serious and require immediate medical attention. Brain aneurysms are abnormal dilations in the arteries of the brain and can rupture, causing a hemorrhagic stroke. Although many aneurysms don't cause symptoms, certain signs can indicate their presence. If you suspect an aneurysm, seek medical attention immediately. Now, let's look at 7 signs that can occur up to a month before a stroke. Persistent high blood pressure. Chronic high blood pressure can damage blood vessels, increasing the risk of stroke. Control your blood pressure with lifestyle changes and medication if necessary. Excessive fatigue. Intense and persistent tiredness can be a sign of changes in blood flow to the brain. Don't ignore this symptom, especially if it's not related to physical exertion or lack of sleep. Vision problems. Sudden changes in vision, such as blurred or double vision, can indicate circulatory damage to the brain. Have any visual changes investigated. Sudden, severe headache. A sudden, severe headache can precede a stroke, especially if it's the worst headache you've ever had. Numbness or weakness in the extremities. Feelings of numbness or weakness, especially on one side of the body, can be a sign of an impending stroke. Even if it's temporary, seek medical attention. Speech problems. Sudden difficulty speaking or understanding speech can be a sign of a stroke. This is known as aphasia. Other neurological symptoms. Memory problems, loss of balance, nausea and vomiting can be early signs of a stroke. These symptoms can appear weeks before the event. Keep in mind that other conditions, such as migraines, seizures, or infections, can cause similar symptoms. Therefore, always consult a doctor for a proper evaluation. Finally, prevention is key. Control your blood pressure, diabetes, cholesterol, and maintain a healthy lifestyle. Avoid smoking, excessive alcohol consumption, and maintain a balanced diet. Exercise regularly and keep up with your cardiologist for checkups. I hope this information is useful. Share it with your friends and family to help save lives. Until next time.